Jama'a Sanga Federal Constituency in Kaduna State covers rural and semi-rural community who depend on agriculture, markets, school, roads and basic infrastructure.
Rep. Daniel Amos, I represent the very hospitable people of Jama'a Sanga Federal Constituency of Kaduna State.
Behind every policy there is a purpose, behind every decision a face, and behind every promise a responsibility.
Your constituents are not waiting to hear you say the bills you have sponsored, the motions you have also sponsored. They want to know what you have done for your constituents, even though the motions and the bills and the oversight and all of that is the primary responsibility of a legislator is for them. But to them, no, we send you there to go bring boreholes, to go bring solar street lights, to go and bring community roads, to bring build classrooms, and all of that.
This is not a story of politics. It is a story of presence of choice made beyond the spotlight.
Anywhere you go, in any corner of my federal constituency, people will be able to tell you that what the honorable member said is done is true. You can see it, you can touch it, yes, you can feel it.
Journey of a leader shaped not only by the laws, but by the lives they touch.
Free medical outreach has been going on since then until today. We've had the first edition in 2022, second edition in 2023, third edition last year, and this is the fourth edition of Oromo Daniel Amos's free medical outreach. And he promised that this program would outlive him. It will continue even when he is not alive. That is his plan. And each year, the number increases. Number increased. About 1,200 people will be operated on general surgeries. But the eye surgeries, where 400 people are expected to be operated. Then 3,000 people are expected to be given reading glasses this year.
On the display of this official flag of the medical outreach, courtesy their illustrious son, Honorable Daniel Amos, member representing Jama'a Sanga Federal Constituency in the Green Chamber. Today he's given free glasses, free surgeries, and a lot more. Come along with me to find out how the people in this constituency feel about this kind benevolence from their illustrious son. For the lawmaker Daniel Amos, service isn't confined to the walls of the legislature. It stretches into the streets, homes, and communities often left waiting for change.
Before I came into office, I started what I call Amos Medical Outreach. We did the first edition before campaigns. We had surgeries for about 500 of our constituents. At that point, of course, our beautiful women and children who were in their need of medical assistance. Some fibroids, some hernia, and we gave, I think at that point, about 1,000 reading glasses. We do it at the end of every year. The last edition we did about 1,000 surgeries of different types. And this comes like very special to me. We discovered that we should go a little deeper than just give people reading glasses. We have people who all over carrying glaucoma and all. So we operated, or rather, about 300 people, eye surgeries. And the interesting part of all of this is you see very little children carrying hernia of different types, and their parents are not able to take them to the hospital to take them out. So going into the theater, you feel this, it comes with this fulfillment that you're able to reach out to your people in different ways.
In the heart of Kafanchan, Jama'a Sanga Federal Constituency, tents went up before the sunrise in all the wards, transforming this open space into a makeshift clinic. And by mid-morning, the crowd was already spilling into the streets. This is the 4th edition of Daniel Amos member representing Jamaat Sangha Federal Constituency in the Green Chamber Medical Outreach Program.
I'm here for cataract surgery for the left eye. You can see the bandage. The honorable member, words are not enough to thank him. We have been having such members in the past, and none have made such an effort to help the poor masses. This is a help direct from the poor masses. I was billed for operation on the 2nd of this month at Eye Center, Kaduna, but because of the strike, you know how much I was billed? 75,000. I'm paying couple less.
Honorable Dan Amos. Shine ya samu ni na taba samun wannan gada basa dan da wancan shekara ma mun wannan ida wannan shekaran kuma gashi za a yi wannan duk shine ya dauki nauyi muna mishi fatan alheri Allah ya saka mishi da alheri Allah ya sa zabe mai zuwa kare ya samu matsala muna mishi addu'an alheri Allah ya sa mishi albarka Allah ya shirye mishi da zuri'an shi gaba daya.
Communities across Jamaat Sangha Federal Constituency are celebrating renewed hope as their illustrious son, Daniel Amos, flags off the 4th edition of his free medical outreach. This initiative now is one of the biggest and largest community-driven health programs in southern Kaduna.
Under my tenure as a member representing this federal constituency, when we had the 1st edition of the medical outreach, little did we know that today, the 4th of December 2025, will be here before all of us, marking the 4th edition. I remember when we had the 3rd edition, I was moved by either emotions or reality to say that I'm going to continue this medical outreach, whether I occupy office or not, so long as I can afford it. And this is so because going into the medical theaters and also visiting the hospital beds, seeing those little ones and our mothers who can afford 1,000 to buy simple drugs to manage their medical condition.
This medical outreach program is an initiative the lawmaker says is designed to close the gap for families who struggle to access public health care.
It is interesting because you see our people line up to be operated. As simple as fibroid disturbs our mothers, women, and as simple as hernia that I didn't know until I start this program that also actually affects children of as small as 1 year old, 2 years, 3 years. You see them line up to benefit from these services, and you wonder that if God didn't put it in our hearts to bring or put together this kind of exercise, what becomes of their fate? And of course, all of us here seated knows what the answer is.
This has targeted thousands of residents with life-changing treatment at no cost.
This free medical outreach organized by the Honorable representing the good people of Jamaat Sangha Federal Constituency.
Nazo iman ake ido. Daniel Amos, na gode Allah ya sa mashi albarka.
As doctors continue consultations, late in the evening, the atmosphere filled with relief and gratitude.
Today marks another opportunity for us because we've been coming here for the past 3-4 years to carry out free cataract surgeries in collaboration with Dan Amos Foundation. So here to operate patients with cataract, and then also give those who have challenges with reading or have doing near work with glasses, and those who have difficulties or allergies in their eyes, we also give them drugs to help alleviate their condition.
Residents say the intervention is not only restoring health, but restoring hope.
It's a program that is unique. Since the creation of Jama'a Sanga, we have not seen anyone doing such a program. He is the first, and he has been standing to the test of time. It's not just inviting people for eye surgery. They go into major surgeries and they give drugs. Unlike other people, even when they will do it, they don't give drugs, most especially the antibiotics. So honestly, we are really hailing him. He is writing his name in gold in the hearts of Southern Kaduna people, not just his federal constituency, because people come all over the Southern Kaduna senatorial area to benefit from this operation.
This year's edition brings an ever bigger promise: 1,200 free general surgeries ranging from hernia repairs to other essential procedures, 3,000 reading glasses to support students, artisans, and the elderly struggling with impaired vision, and 400 eye surgeries offering renewed sight and hope for beneficiaries who have waited years for help.
Over 1,200 of our constituents will benefit from general surgeries, and over 400 will benefit from eye surgeries, and we have over 3,000 reading glasses to be distributed, or rather given to our constituents.
For many here, these are not just numbers, they are lifeline. The outreach, funded and facilitated by the lawmaker, become a signature program in his constituency, bringing health care to the rural communities that often lack access to special amenities and medications.
Daniel Amos is doing. He's a nice person, wonderful in this constituency, a leader that will support you in any move you make. We love his movement and we want to continue praying for him so that God will always protect and provide good things for him, so that it will reach us. We are here to celebrate
chairman and the our chairman to please come father, for the opening prayer.
Our brother, our Oga, everything. Honorable Dan Amos is one in a million. I have never seen a man like Honorable Dan Amos. He touched the heart of the grassroots.
But the outreach is only a chapter in the broader story of service in recognition of the lawmakers' consistent support for grassroots development. Honorable Daniel Amos was recently honored with an award by the Nigerian Union of Local Government Employees, Sonkwa branch, an acknowledgement of leadership that prioritizes people and progress. His media aide, Mr. Victor Dabo, received the award on his behalf.
By God's grace, our brother for the last 4 good years has been sustaining and ensuring that we reduce the casualty of our men, young women, and daughters. So on behalf of all of us, I want to say thank you very much. That he's a person that promises something and get it what? Done. So these are the kind of politicians that will look onto. That when they talk, they also go about what? They show us with also action. To be a leader in the right direction. And I'm going to call all of us to continue to support him. He cannot solve all the problems, but he's setting a foundation for others to follow.
As the medical outreach was ongoing, the lawmaker paid a courtesy visit to the custodian of tradition and custom of Jama'a Emirate, in a move aimed at strengthening ties between modern governance and traditional institutions. The visit, marked by the warm and mutual respect, underscores the lawmakers' commitment to inclusive leadership and continuous engagement with traditional rulers, whose role remains vital in promoting peace, unity, and cultural heritage within the Emirates. Another milestone opportunity opened for youth as the legislature facilitated the recruitment of qualified constituents into the Nigerian Army Depot Zaria, offering them a chance to serve the nation, secure a future built on discipline and purpose. Their names are as follows: Faisal M. Abdullahi, Gidanwaya, Ward; Chinedu Solomon, Aso Ward; Jamilu Danjuma, Gwanto Ward; Maazu Tanko, Gwanto Ward; Danjuma Musa, Ninzo South Ward; Miracle John, Bako, Fadan Kirshi. Together, these initiatives fulfill the representation defined by action healing the sick, empowering workers, and creating pathways for employment and national service. As the curtain falls on the outreach, the message remains clear.
As governance is concerned, when you are in government, you put party aside and work for your people. And as far as you are a son of this soil, when you are doing anything belonging to any party, I believe we should pay you that respect and support you because you are our own. We have seen it. A lot of people have received backup or assistance medically. I pray as you continue to serve in your office, you will continue to do the good thing for the purpose of humanity. I pray God Almighty will keep you in good health and with long life. The people of Jamaat and Sangha, I want to say one thing. When somebody has done well, please, let's return back the good thing he has done.
When leadership is driven by service, its impact is felt across the lives, livelihood, and generations.
Our target is to significantly expand across wards in both Jemaah and Sangha, ensuring that no community, however remote, is left behind. Through our expanded partnership with Graceland Healthcare Foundation and other medical collaborators, we have secured more medication and diagnostic support to ensure people receive not just diagnosis but treatment. We are intentional about reaching those who struggle the most with healthcare access. Why do we do this? For me, this outreach is not politics. It is humanity. It is our belief that the dignity of our people must come before anything else. It is our belief and conviction that governance must be felt at the household level, not in speeches alone, but in real change. Healthcare should not be a luxury. No child should suffer because his or her own parents cannot afford treatment. No elderly person should endure pains because help is far away.
As the medical outreach that lasted for a week comes to a close, the impact lingers far beyond the last consultation and the final close of the medication for many beneficiaries. It is a renewed sense of care, compassion, and inclusiveness in governance.
The fourth edition of this outreach is a celebration of progress, continuity, and hope. It is a glowing testament to what we can achieve when we put humanity first and leadership at the service of our people. For your support, prayers, and unity that have made this program possible, we will continue to build a constituency where every life matters, every family is valued, and every community is strengthened. With gratitude to God and with profound love for our people, I stand as your representative today. Tomorrow, and until the end of this tenure, to make one pledge that I've always made whenever I have the opportunity before any gathering, that Jemaah Sangha Federal Constituency will continue to get the best of representative or representation anywhere within the constituency, Kaduna State and Nigeria. So help me God.